Tom, and these are my Osce videos for pre-hospital clinical assessment. Okay. So hi there, my name's Tom, and I'm your physician today. What was your name?
Hugo.
Hugo. Oh, hi, Hugo. Now I'm going to do an abdominal assessment. That's going to involve me asking you a few questions about your health and having a bit of a feel and a listen to the different parts of your abdomen, if that's okay.
That's all good, G.
That's fine? Sure. Okay. So that's fine with you. Now I'm just having a look around the patient's bed and a look at the patient. I don't see any obvious signs of a colostomy bag or having any other equipment like dialysis or anything inserted. There's he also seems to be of a good posture. He's not sort of winced over in pain or anything like that at the moment. He's not particularly obese, and the cachexia, he doesn't seem to have any morbidly ill conditions that have caused him to lose a significant amount of weight or have a quite pale appearance. So that's all fine for our patient at the moment. So he's not in any obvious pain at the moment, and he's not guarding or posturing himself to protect that abdomen. So I'm going to position him in the supine position and proceed with my abdominal assessment. So Hugo, if I could get you, we're going to shuffle you down the bed a little bit, and I'm going to get you to take your shirt off, and I'll just remove this pillow if that's okay.
Okay.
Are you alright to do that?
Yep.
You're not in too much pain?
No, that's fine.
Sure. Okay. Well, if we do that. Yep. And you just lie down flat there and take your shirt off. That'd be great. I'm also just putting on some gloves for my PPE. So I'm just going to gain a little bit of a history of what happened this morning when you started to feel the pain that you told me before. What kind of pain is it?
It's like well, I don't know, it just feels like it's cramping all the time, and it's real sore. I just, woke up like it.
And when did it start?
Well, this morning when I woke up, really. I woke up because of it. I woke up early.
Yep, yep. And is there anything that makes it better or worse, or?
Well, whenever I move, I don't feel like eating, so.
Okay. And is there any other conditions that brought on this morning? Do you have vomiting or diarrhea or constipation?
Yeah, so I vomited, I didn't eat breakfast because I wasn't hungry, and then I vomited. Nothing came out though, it was mainly just dry reaching and diarrhea as well.
Diarrhea? And how long have you had the diarrhea and vomiting?
Well, just ever since this morning.
Just this morning?
Yeah.
Okay, sure. Alright. And have you taken your temperature this morning?
Yeah, my mum did, and she said it was quite high.
Quite high?
Yeah.
Okay, sure. So the patient states that they have had vomiting and diarrhea this morning, and they've got pain in their right lower abdomen, or that kind of area just in there. So we'll proceed with an inspection of the abdomen and anything that's there, and then I'm going to auscultate, palpate, and perform some percussion. So now I'm going to inspect the abdomen, and as you can see here, there aren't any obvious scars that have resulted from surgery or from trauma. So there's the absence of that. There's also no stomas or anything coming out of the stomach, so it doesn't look like there's been any surgical interventions there. The patient also didn't state that they had any surgical history to do with the abdomen, so that rules out that. There's also no distension of the abdomen, it's of a good size, and there's no obvious swelling. There's also no obvious masses other than his rib cage across the top here, and he's not particularly obese, so it's easy to see and make out the different parts of the abdomen. It doesn't appear to be pulsating, and his rest rate seems fine. We've also got an absence of Cullen signs and Gray Turner signs, which is where there would be bruising. Gray Turner's sign refers to bruising around this area, and it's between the part of the body that's from the last rib to the start of the hips, and there could be bruising in there. This would be typically blue or purple, and it's a sign of retroperitoneal hemorrhage or bleeding behind the peritoneum. Cullen signs often goes with this, and vice versa. Cullen sign is a superficial edema and bruising of in the subcutaneous fatty tissue around the umbilicus, in this kind of area, and it can be a sign of bleeding. It can be a sign of a ruptured ectopic pregnancy, or other ruptures within the abdominal cavity. So the other thing that's not present is caput medusae, and that would be a tree-like structure going across the abdomen from the umbilicus across the abdomen, and they're like the superficial veins in the abdomen, and they radiate across, and that could be a sign of several things. It can be part of syndrome of portal hypertension. So before I start with the auscultation and palpation and percussion of the abdomen, I'm just going to explain that the abdomen is split up into several different quadrants. So before I auscultate or palpate or percuss the abdomen, I'm just going to explain that it's split up into several different quadrants. Some physicians like to do this in just 4 quadrants across the abdomen, splitting at the umbilicus. And that's described as the patient's left upper quadrant, right upper quadrant, left lower quadrant, and right lower quadrant. However, I'm going to be splitting up into 9 different quadrants, and that's made up of the right hypochondriac region, epigastric region, right hypochondriac region, epigastric region, left hypochondriac region, right lumbar region, umbilical region, left lumbar region, right iliac region, hypogastric region, left iliac region. Because I'll draw it on in the same. Okay, so now I'm going to auscultate. We'll go from there. So, Hugo, is it okay if I auscultate your abdomen and just check for any irregularities?
Yeah, gee, that's all good.
That's fine. So I'll start with listening to his bowels, and I should be checking for good tone and consistency and rhythm. And they sound fine. Now I can check the rest of the abdomen for any bruit, and you would do this in the upper region, right across from the right hypochondriac to the left hypochondriac, including the epigastric region in the middle. And bruit are just any other sounds that you might hear in the abdomen, any muffled sounds you get through the stethoscope that can't be associated with anything else. And there aren't any present there, so that's fine as well. We'll now move on to palpation, and this will involve the placing of my hands on the abdomen at the different quadrants that we've laid out, and rolling from the lower knuckles into the tips of my fingers, and checking first, doing it reasonably softly as the patient does have pain in their right lower quadrant, and just checking to see if where the pain starts, where it goes to, and if there's any other masses or guarding or tenderness in any other areas, and just in case there's any rebound tenderness or unexpected tenderness. So Hugo, if that's alright, I'm just going to palpate your abdomen now.
Yeah, what does palpate mean?
I'm just going to...
No, just like
Yeah. Okay Hugo, so if it's alright, I'm just going to have a feel of your abdomen now. I'm just going to palpate across, and you just let me know if there's any pain in any places, or if it gets worse or better, and how it feels. Okay, so just starting with the right hypochondriac region.
Yeah, it's a little. Yeah, it's not too bad there.
And moving into the epigastric region.
It's alright.
The left hypochondriac region. Is there any pain at all?
Yeah, a little bit.
Yep. The right lumbar region.
Yeah, that's a little bit more sore there.
That's quite sore there. The umbilical region. The left hypochondriac, the left lumbar region.
Yeah, it's a little bit sore there actually too.
The right iliac region.
Oh, yeah.
The hypogastric region.
Yeah, a little bit there as well.
and the left iliac region.
Oh, yeah, and there.
Sure. So there was some tenderness on palpation, but there wasn't any obvious rebound tenderness across on the other side of the abdomen. It was just mostly on this right-hand side of the abdomen. Now I'm just going to have a feel of your liver, gallbladder, spleen, aorta, and bladder, just to check for normality and size and ensure that there isn't any rigidity or anything there. Okay, now I'm going to palpate the liver, and I'll do this by just firmly feeling in here. Let me know if it's too painful. You do the hook motion, just relax. A hook motion underneath the rib cage, and you should just be able to feel the tip of it just in there, which I can feel. If I could feel too much of it, that would suggest it was inflamed or there was something else wrong. Okay, now I'm going to palpate the spleen, which is on the opposite side to the liver, on their left upper hypochondriac region. And I can do the same maneuver that I did on the liver, and I should only be able to feel just the tip of it again, which I can feel there. If I could feel more than that, that would suggest that it was inflamed also. And now I'm going to palpate the bladder, which is down here. I should only be able to feel some of it. It shouldn't feel firm or distended, and there shouldn't be any amount of pain when I'm doing this. Is there pain there, Hugo?
No, it's alright.
And now I'm going to just palpate the kidneys as well, which are actually on the back. So I'll just feel up and then the back of the patient there, pushing, giving some slight force from the front and pressing into the back, and they shouldn't appear to be firm or sore. So that one appears to be fine. There's no wincing from Hugo or guarding, and this side is fine. That side is fine as well. Okay, now I'm going to percuss the liver. That involves putting 2 fingers, one on top of the other, and then tapping. And this helps to keep the force from dispersing, and it will give me an audible sound. So we'll start with the liver over here. And there doesn't appear to be any abnormal sound, and it seems consistent across the liver, so it wouldn't appear to be any inflammation. The other percussing technique for the liver is to put your whole hand down here and give it a couple of dull thumps and check to see if there's any wincing or pain on the other side as well, and whether they feel the same. Now I'm going to percuss the spleen. That involves putting 2 fingers down here again. And that all sounds consistent across there as well. Now I'm going to percuss the bladder, which is down here. And that all sounds consistent across there as well. So the differential diagnosis is appendicitis, as Hugo has some pain on the lower parts of his abdomen on the right hand side there, in the right iliac region, and it kind of radiates across to all of the other regions of the abdomen in a dull sensation, and it's particularly sharp in this right lower region. He also included vomiting, diarrhea, slight raise in temperature, loss of appetite, which are all consistent with the differential diagnosis of appendicitis. The acuity for this kind of illness is to get him to hospital as soon as possible. I'll be giving him a status of 3, which is non-life-threatening. It could be life-threatening, and we could have to raise it 2 if he had significant abnormal vital signs. However, as a current, he doesn't, and the pain is not exceptional. So he does need to get to hospital as soon as convenient and possible. However, it's not urgent that he travel swiftly.